The big catch-up immunization campaign, which aims at vaccinating children against the 14 killer diseases and the vaccination against cervical cancer, attracted a number of district leaders and the community members who graced the event. Mr. Gore Goffin, the resident district commissioner Moyo, during the launch, lauded the government for rolling out the vaccination campaign across the country and urged the public not to have negative mindset on vaccinations, saying government cannot engage in acts which can depopulate its people because government works with the people, not trees.
All the community members not to have negative attitude towards vaccination. When COVID medicines came, everybody had that negative feeling that people not produce. Now these children whom we are vaccinating today, are their mothers not all vaccinated with the COVID vaccines? They are producing. So it is just a myth, it is just a fear for nothing. Government of Uganda cannot allow anything to take place in Uganda if it has not tested and proved it true. All the vaccines you are receiving, even for the young children, young girls of 10 years above, it is to protect them against cancer.
Honorable Anyanzo Terry, the Secretary for Education, Moyo District Local Government, who represented the Chairman Local Council 5 Moyo, said, according to statistics, out of 1,000 newborn babies, only 43 die across the country, which puts the coverage to over 90%, and appeals to the parents to take their children for vaccination so as to achieve better results.
Out of 1,000 children born alive, only 43 die in the whole of Uganda, meaning that the coverage is over 90%, and that is a very good achievement on the part of this government. Government discovered outbreak of measles in 30 districts of Uganda. They discovered that most of the children in these districts were immunized and others are under-immunized.
Mrs. Onger Tojeska, the Chief Administrative Officer Moyo, thanked government for taking up the initiative to immunize the children against the 14 killer diseases, adding that all the necessary services are being brought closer to the people, but those who do not want to be served are the ones suffering, and implore the public to take advantage of the available services so as to benefit and transform their lives.
By the way, where we are, it is people who don't want to be served are the ones who are suffering. Because if you want services, they have brought them nearer to you. We have the schools, we have the health facilities. At least government is trying. So for me, as a head of service, I will say let us take advantage of the services. Let's use them. Otherwise, we are not going to have any excuse for not benefiting from the services we have.
Adrawa Michael, the Assistant District Health Officer in charge of maternal and child health, gives the details of the people targeted by the campaign, adding that for now close to 2 decades, Moyo District has never registered cases of polio, measles and other killer diseases among the children, and urged the parents to embrace the campaign so as to give their children good life.
We are mainly targeting children who are not or who are unvaccinated. But the second category is children and other groups who have started the vaccine but they have not completed what we call under-vaccinated. So our village health teams, our mobilizers, our health workers and all the stakeholders are doing what is possible to mobilize this category of people for vaccination. Over the years, we have seen the benefits of vaccination. For example, in Moyo district, for the last 20 years and also, we have not seen any child with the paralysis as a result of polio.
Tajita Grace, a mother, outlined the importance of the immunization and requests the parents to always take their children for immunization so as to raise healthy children.
The children are not so much suffering from diseases, preventable diseases like malaria, or maybe polio, measles. Does not disturb my kids. The other important of this immunization. I think also it prevents other kind of infections. We have so much infection these days, if we may say there's bacterial infections. So when you take so much of the immunizations, it prevents some of the infections.
In January this year, the Ministry of Health registered cases of measles outbreak in over 30 districts across the country, something which led to the recent launch of the big catch-up immunization campaign against the 14 killer diseases among children, with the aim of eliminating the disease out of the country for good. Dominic Anthony Okumu, West Nile TV, Nilecast.